The unvaccinated, they're scum. They caused this pandemic, and if they didn't cause it, they certainly made it worse. And there's absolutely no reason why they should be cynical about taking the medications that are recommended to them by the very people that caused an opioid crisis in the exact communities they live in. Is there? Hello there, you 5.7 million awakening wonders. Thanks for joining me on this great voyage towards truth. Yeah, the seas are choppy sometimes. Occasionally there's gales of mistrust, disinformation, misinformation, disinformation, kisinformation. But we will get there together. I'm certain of that. Turn on the notification bell right now if you've not turned it on already. Who knows if we can trust this algorithm? In the hasty rush to condemn unvaccinated people, one of the many overlooked factors and nuances that ought to be discussed in a thing called a democracy was that many of the people that didn't want to get vaccinated because they're suspicious of pharmaceutical companies come from the very communities that suffered most as a consequence of the irresponsible behaviour, and that's legally proven, of big pharma companies that profited from the opioid crisis. I spoke to David Sirota, creator of the film Don't Look Up, about this issue and about the complexities that emerged during that time. Stay to the end of this video, you're going to love it, and comment and let me know what you think about it, and let me know if these kind of conversations between people across the political spectrum is exactly what's needed for your democracy.
These stipulations cannot be divorced from this unaddressed emotional quality to which you keep referring. In the last couple of years, David, the rise of censorship, the rise of the surveillance state, the incredible profits garnered by the pharmaceutical industry, the closing down of debate around the subject of coronavirus, the inability to correctly track and reveal information as it came to light around immunity, the efficacy of lockdown, the let's call it the sort of leftist control of that conversation, I think further fueled this animosity towards institutions. Now, I think that when people feel that they are simultaneously being censored and that powerful interests are profiting while regulatory bodies are granted more authority to legislate, that a kind of a populist surge of emotion is exacerbated. One of the things I'm interested in, David, and I wonder how this meets with your particular background and evidently a vast skill set, is how do we address the spirit that is the spirit of American people? The sense that, see, whilst like you say, there is a priority to it, if there has been, a violent insurrection and that has to, and a refusal to accept the outcome of a democratic election, which you know loads of people will continue to dispute, and there are documentaries about that kind of, what I mean. But I'm sort of, it's not really something I'm interested in, because me, plainly, I don't think Donald Trump is the solution to the problems of ordinary
Agreed.
American people. Joe Biden, he ain't the solution to the problems of ordinary.
Agreed.
So in a sense, we can dismiss all of that and start moving into some new territory. And I wonder, will you speak to us about the relationship between well, not just, but the Democrat Party and Big Pharma, and what you feel was revealed to us during the pandemic around the trust in institutions, the ability to make profit, the ability for the pharmaceutical company to control those narratives, some of the stuff around that pill, that Merck pill. I know I'm sort of citing stuff of yours that I've read, and I wonder if you'll talk to us about some of that stuff with Big Pharma and like a trust.
Look, the Democratic Party's relationship with Big Pharma is a huge problem. And I want to be clear, both parties' relationship to Big Pharma is a huge problem. You had a situation where the government in various ways basically funded COVID treatments, helped fund the development of vaccines, and then allowed the pharmaceutical companies to basically fleece everybody on those vaccines. Now, they were distributed freely in the United States, but at a great cost to the government. And I think they should have been distributed freely to people who wanted them. But the point is that the pharmaceutical industry made quite a set of profits, despite the fact that the federal government was on the development side putting money in. In other words, the return on the investment was sort of the ripoff here. And that's been going on a long time. In the United States, we have a situation where most medicines, of innovative medicines, are first funded by research at the National Institutes of Health, which is the public's money. And in the mid-1990s, a regulation was taken off the books under the Clinton administration, which said that when the pharmaceutical companies get the government's taxpayer-funded research and development, they have to return the favor to the public by offering the final drugs at a quote-unquote fair and reasonable price. Seems like a fair idea. If we, the public, invest the money in the development of drugs, the return on our investment is we don't get fleeced. Yeah. Instead, we now pay, the United States, Americans, pay the highest prices for medicine in the entire world. And we are paying the highest prices for medicines that we originally funded the research and development for. So that is rigged into the political system. And the Democratic Party and the Republican Party, that has been a bipartisan initiative for all the way back since the mid 1990s. The Democrats have promised to allow Medicare to negotiate lower prices for prescription drugs. They have continued for I think it's 15, 20 years to make that promise and not deliver on it. Pharmaceutical money continues to buy both parties. Because I want to be clear, don't let Mitch McConnell off here. He is one of the biggest allies to the pharmaceutical industry as well. Now, listen, I think in the debate over COVID vaccines and the like, and the efficacy and immunity stuff, I think we have to recognize that there's an information problem here, and as it relates to science. Something like a pandemic, and I come from a family, my dad is a doctor, my brother's a doctor, my brother, in the hospital seeing all this happen in real time. My father-in-law is a doctor. I got a lot of physicians and doctors, medical people, right? Good people working with patients, right? They don't have a political agenda. And what they will tell you in general, most doctors, listen, science does not work out to binary answers most of the time. It is not a kind of black and white set of issues. So if you've ever seen somebody treated in the hospital in a trauma unit or whatever, there's a lot of art and not just science. It's not just you're a machine and you plug into, and there's a diagnostic test. These are very, very gray issues about treatments and the like. Now, I want to be clear. In my view, vaccines have been shown to work. They are effective. They are not 100% effective. And most scientists, most doctors will tell you almost no therapy is 100%. Now getting to the problem. Here's the problem. I think we have been infantilized and taught to think that the only thing that we should accept are black and white answers. It's either yes or no. Now, I am very much on the yes, vaccines work, they are effective, we should promote them to the population to try to stop the spread of COVID. COVID can be very bad in lots of people. It killed a lot of people. We want to prevent that. But I think the problem is that what we know is that on the edges, if a vaccine is, a 98% effective, there are going to be cases where there's 2% that there's complications and the like, and we have a media system that will blow that up to sort of try to chip away at the actual science of the 98%. In other words, we do have a media and information ecosystem that takes the non 100% aspect of things and blows them up to try to break up basic verified consensus over basic things. It goes to what we can stipulate and what we can't. If I can stipulate to you that vaccines aren't 100% effective, as one example, it doesn't necessarily mean that they shouldn't also be promoted. But there can be all sorts of kind of not conspiracy theories, but efforts to try to blur things up about what a proper public health policy should be. And I'm saying this, look, I'm not a doctor. I'm not a scientist. But what I'm saying is that I worry about the fact that we're having trouble making science-based decisions because and accepting science-based public health policy because of a rightful suspicion that our government hasn't told us the truth in the past. But we also need to have basic public health decisions made. I was watching the show, I think it was called Dope Sick, about the opioid crisis. And I thought a lot about how the areas where there's some of the lowest vaccine rates in the country are the areas that were hit hardest by the opioid crisis. And if you think back to what the opioid crisis was, it was the government, the FDA officials saying to lots and lots of people, these drugs, these medicines, these therapies are safe. And they weren't safe. The medical establishment said it was safe, and they weren't safe. Now, listen, two wrongs don't make a right? But you can imagine that people who lived through that, who lived through being told that these therapies were safe, then along comes the pandemic, and the same agencies are saying, listen, the vaccines are safe, the public health policy is the right public health policy. Now, I think the vaccines are safe. I think the public health policy, it hasn't been perfect. There have been a lot of issues with it, but it's an imperfect, difficult situation. But I think that suspicion from living through the opioid crisis must have sown a kind of general suspicion of, listen, I'm not necessarily going to take the word of the people who just told me last time that things were safe. And I get that suspicion. So my question is, if we can acknowledge and accept that suspicion, if we can acknowledge and accept that things are not 100%, well, how do we then, inside of this information ecosystem, make decisions knowing that they're going to be imperfect, that that science doesn't give us exactly 100% yes or no answers, and that's the big question.
Yeah, there are several questions, David, that came up for me there. Is firstly, earlier when you said that science is a non-binary discourse, it's an ongoing and mutable ideology that's responding to evolving information continually. I thought that's an important point. This is sort of quite sweeping, but has been a relatively applicable paradigm in the kind of conversations I found myself having. That part of the problem is that both media and science are not independent entities. They are subsets of a dominant financial ideology. So science does not exist outside of whatever we are calling our current state of late capitalism, i.e. what kind of research is being funded, what kind of research is not being funded, what kind of stories are being reported, what kind of stories are not being reported, which advertisers fund media, which organizations do not fund media. All of these things are tributaries that lead to what becomes regarded to be sort of a common consensus and a common truth.
Thank you so much for watching that video. Let me know in the comments what you thought of it. Please give the video a thumbs up, turn on the notification bell, and sign up to my mailing list. Remember, it's the only way that I'm sure that I can stay in contact with you in very complex times. If you enjoyed that video, have a look at either one of these. More important than any of that, though, is that you please stay free.